Welcome back to Plastic Surgery TNA. That's Talking Advice, where I pull back the curtain on everything you need to know about aesthetic plastic surgery. I am Dr. Earl Stephenson Jr., your Atlanta board certified plastic surgery, and I am your guide through the intricate world of plastic surgery. Today, I really want to take time to tackle a subject that really isn't glamorized. So if you tune in today, and I appreciate those who have tuned in, new and returning, I really do appreciate that. But this is not an episode that we're going to have a lot of pictures and discussions about salacious cases. This is really, really important information. So I really encourage you to listen to the entire podcast today. You know, get your coffee, go through your morning routine, tune me in, and just put me in the background and let me play because I want you to listen to this entire podcast, whether you're watching or you're listening on one of our uh, audio podcast platforms. I really, again, want you to hear what I'm going to say today in its entirety. We're going to talk about, again, something that's not glamorized. When you go to Instagram, you go to Facebook, and you see these before and afters, and people dancing, and doctors dancing. You know, this is where I started, and this is where I ended up. No one talks about really the middle, and nobody talks about things that occurred that weren't expected. So we're going to talk about how you as the patient, how you as the client can anticipate unexpected procedures, events that can arise just from having surgery because this is still surgery, whether it's aesthetic, cosmetic, whatever you want to call it, it's still surgery. So, in your pursuit of confidence, it's easy to get caught up in the potential results. And you should be excited about that. But you want to have that frame with the realities of the possibilities and be prepared for the what ifs so that you can navigate those bumps in the road with confidence and peace of mind. So, what I want to do is touch on five things today. I want to talk on the realities of complications, number one. Number two, I want to talk about financial preparedness. Number three, I want to talk about how you manage recovery and work schedule. Number four, we're going to talk about your emotional resilience and how to be prepared for that or increase that. And then finally, we want to talk about how we can empower you as a potential patient or a potential client. And I made notes, and I usually make a few notes, and I'll sit up here and skim those and then really kind of go really organic just based on principle. But I really made an outline. So I'm going to refer that because I think this is super important. I really don't want to miss anything. I want to make sure I hit all my points. So you'll see me kind of shuffle and with papers or mess with my computer because again, I want you to hear. I want you to hear what I'm saying. So, with that being said, let's just step right into it. Number one, the realities of complications. Look, every surgical procedure, no matter how routine it seems, you're going to have a keloid removed from your ear, a mole from your face, carries some risk of a complication. And it really can happen to any surgeon. It can happen to the most skilled surgeon. So that is a reality of surgery. And these factors that factor into complications are beyond your control, beyond the surgeon's control. And it's really how your body responds to surgery. That is the crux of how these things can originate. Occasionally, there can be some things that are within our control, like how well post op or follow up instructions are followed and underlying health conditions, not ones that we know, Sometimes underlying health conditions are unmasked or revealed because of surgery. And so that can lead to complications that just weren't anticipated. So what are some of these complications that I'm talking about? I have two kind of broad groups initially. You've got surgical site infections, which is what it sounds like it is. It's an infection caused by bacteria that causes swelling, redness, drainage, and that is just either from unhealthy tissue or kind of a perfect storm where a certain group of bacteria got into the surgical incision or site and set up shop. So that's one broad subject or topic. Then there's surgical site collections, and that's a collection of fluid. They're basically two types. There's a healing type clearing fluid, which is called a seroma, and then there's a collection of typically old blood, sometimes active red blood, if I can use that term, called hematomas. So those are those two types of complications: surgical site infections, surgical site collections, and then there's unexpected scarring. You may not have known that you had a history of keloiding. No one in your family had that problem, but here, lo and behold, here you are. So that's another group or subset of complications. And then you have more severe uh, potential complications like nerve damage. That can happen from surgery. You can have, poor circulation to skin that causes or leads to death of the skin, which is called necrosis. So all these may need and typically need some type of intervention or revision surgery. And no one really wants that. No one sets out for that. Nobody wants that. So, but these are the realities that really need to be discussed openly at your consultation. This is where we need to meet these issues and discuss these issues head on before we both go behind the OR door. So it is important when you, as a client, are scheduling a consult that you have time with your plastic surgeon. It's not this 15 minutes in and out. And I can get into why that happens, but we're not. But it's you get to spend time talking with your plastic surgeon so that your questions and issues such as these can be addressed on the front end. Understanding and preparing for the possibilities is really not about me as the plastic surgeon to cause fear in you, but it's really to build a foundation of knowledge so that so that you feel more comfortable about the possibility so that you can make the best decision for you and you feel confident when you do make that decision to move forward that you've covered all your bases. So those are the realities of complications. And so it really is a discussion about hitting those head on before anything is done so that you can understand that these things are possible. And then with these things being possible, how do you prepare for them if they do occur? So the next thing I want to move into is the second way that you can be prepared for these unexpected events is preparing your money. No one wants to be worried about money when you're trying to heal. And no one wants to worry about money that they didn't anticipate spending. And that's where the rubber meets the road. So, plastic surgery, as you know, can be a significant investment. Many patients really understand that commitment and prepare for the cost of the surgery, the cost of the garments, the cost of the medications, but rarely, if ever, factor in the cost of any potential complications that may need treatment. or additional procedures or extended recovery or additional medications. That's not talked about. So you need to be prepared financially for those events. And here's a practical step that you can use when you're on the front end preparing yourself. You found your surgeon, you like him or her, you like the price, you've gotten your funds set up for that particular procedure. You need to set up a little bit of an emergency fund. I like to call it rainy day fund. Other people have other names for it, but you want to set that aside. That's in addition to what your quote says. And that is a goal of having that fund equal about 20 to 30% of the total cost of your procedure. Let me say that again. That's 20 to 30% above and beyond what you plan to spend for your facelift, for your mommy makeover, for your eyelid surgery, for your breast augmentation. So, for example, if you're going to get a face and neck lift and it's going to cost you $20,000 and you're good with that, you're prepared, you're ready for that. If there is a problem or complication and you need additional procedures, more recovery time, more treatments, wound supplies, medications, so on and so forth, you need to have 20% more than 2,000. So you need to have at least 4,000 additional dollars. So now your total cost goes from 20,000 to 24,000. If you push up on the 30%, now you're talking about $6,000 more. So you're in total going to have $26,000 as a buffer. So 6,000, $4,000 to $6,000 extra as a buffer if something doesn't go as planned. So set yourself up for success so you don't have to worry about, oh no, he says I have to go back to surgery because we have X, Y, and Z and we need to correct. And how am I going to pay for anesthesia? How am I going to pay for more medications? I have to take an extra week or two off. How can I meet my bills? Having that buffer, that excess 20 to 30% above the cost of procedure will help you with that. The second way you can prepare yourself financially is hopefully that you're going to plastic surgeons that offer cosmetic surgery insurance. And yes, there are entities such as surgery insurance. There are companies like Cosmetasure, and that's what we offer in my practice, and Aesthetic Sure. And these are insurances that cover for elective surgeries. Your medical insurance, Cigna, Blue Cross, Travelers, you name it, may not cover any complications from cosmetic surgery. You may try to present them with, an issue to see how much your medical insurance would cover, and they're probably going to tell you that's not our problem. This wasn't medically necessary, so we're not going to try to bail you out. So again, on the front end, it's really important to get yourself a cosmetic insurance policy. And like I said, in my office and in like many offices, at least around Atlanta, and I'm sure around the nation, offer cosmetic surgery insurance from Cosmetic Sure or Aesthetic Sure. And these policies aren't really expensive at all. They're not thousands of dollars. They run in, as far as Cosmetic Sure, run from about $150 to $230. And they cover things pretty well. They'll cover things like hospital stays, some forms of additional surgery. If you have, abnormal blood pressure that you need to be placed back in the hospital or placed in the hospital, they'll cover that hospital stay. They'll cover, again, additional surgeries if you need some type of revision or you need a drainage of a surgical site collection. They'll cover that. So it's good to go ahead and spend the extra 150, 200, $300 so you have that peace of mind. So if your surgeon, your plastic surgeon, doesn't offer that, then you need to make sure that somehow you get that resource and so that you can get yourself covered. And at the end of this, I'm going to give you some links to so that you can understand what these insurances cover in case you have chosen a surgeon, you like the surgeon, you like their work, but they have no clue about these things. And maybe you can get yourself positioned and get that resource so that you can cover yourself. So that's a second way that you can prepare yourself financially for any unforeseen outcomes. The last thing to do is, what are you going to do about work? How are you going to prepare to financially meet your obligations at home because you're not working, because you need additional time off? I mean, if your job doesn't pay for medical leave, what are you going to do? So you might want to discuss this really with your employer ahead of time. Nobody likes to talk about their personal business as far as aesthetic or cosmetic surgery, but you might want to have that discussion. I'll leave that to you, but it's certainly a strategy so that you can get ahead of this. Some companies may really offer short-term disability benefits. Maybe you're able to navigate or negotiate for a return to work schedule that's flexible. But you might want to get ahead of this with your employer with a discussion before you even, have the procedure, because you need to plan for that one way or the other. The extra cash that we talked about before may covers that, but it may not cover everything. Having a flexible work schedule or short-term disability benefits certainly will definitely help. Because again, when you're trying to heal, the ultimate goal is a speedy recovery. The last thing you want to be focused on is money. You want to focus on healing. That moves us into point number 3. Time is money. That's a that's an old adage of finance. The time value of money. Time is money. You need to manage your recovery, and again, just a nice transition, manage work. You know, being overprepared is never a problem. You want to make sure that you take the appropriate amount of time off for work on the front end. Everybody wants to get back to work sooner because they don't want to miss their money. And so again, they have obligations they need to meet. And sometimes employees are a little tight on time and they don't pay you for time off. But n- nonetheless, you need to try to get the maximum time off that makes sense. Example, if you have a tummy tuck and you're planning to go back to work in 2 weeks and you have a administrative job, nothing physical, and you develop a fluid collection, a surgical site collection. And that seroma, the healing fluid, needs to be drained. And now we've got a slight wound, and we need to have, dressing changes and maybe 1 or 2 nurse visits, or definitely doctor visits in the office that weren't anticipated. Now your 2-week return looks more like 4 weeks. And if you told your boss that you'll be back to work in 2 weeks, he or she is not going to be real happy when you come to them near the 2-week mark and say, I need 2 additional weeks. So it's really better if you can take 4, take 4. If you can take 6, take 6. No one ever, ever gets mad if you heal faster from an unannounced event, or you just heal faster in general because everything went seamlessly and you didn't have an unseen event, and you want to get back to work earlier. No one ever gets pissed about that. People get pissed about you coming back after you said you would you would come. Meaning, I didn't say that eloquently. You asked for 2 weeks, and now everybody's anticipating you're coming back in 2 weeks, and now you're like, I need 2 more weeks. So people are going to be upset about that. No one gets upset if you say you're going to be out 4 and you show up at 2. They'll probably throw you a party. So Try to maximize your recovery. Try to get an extended recovery. The second thing to prepare for during your recovery or your extended recovery, because we're talking about an unforeseen event, procedure, or outcome, is you got to lean on people. You're used to being busy, you're used to taking care of kids and taking care of the house, or maintaining your own routines as far as exercising and work, as we've talked about before. There needs to be an extension of the temporary shift in responsibilities. That means that you need to further encourage and garner additional help, whether that's from your plus one, your spouse, your live in, your family, your friends, or even hire a caregiver for the few additional weeks that you are most vulnerable. You're going to need that. And maybe thinking about that on the front end, if your husband knows that he can only take off 2 weeks and now your recovery is 4 weeks, maybe put in play your sister or your neighbor, or if you're in healthcare, tap into some of your colleagues, just in case I need an extended recovery time. Could I ask you possibly to step in to help me? Go ahead and get prepared for that, because you want to have that in place so that if this happens, you're not scrambling, which creates stress and anxiety because you weren't prepared. So prepare for your extended recovery by recruiting additional soldiers for your army. Point number four, which I think is as important as anything. This is an emotionally tough time. Dealing with complications taxes your mental health and well being. Let me say that again. Dealing with surgical complications and heck, just recovering from a routinely taxes your mental health and well being. When you have an unexpected event that leads to additional surgery, additional costs, additional medications, that is emotionally challenging. It is frustrating. It produces tremendous anxiety. It drums up disappointment, even regret for doing this at all. So you've got to be prepared for that. You've got to acknowledge that that's okay. And as the plastic surgeon, if clients or patients acknowledge that, don't get defensive. This is not about you. This is not about me. You acknowledge their feelings and validate that because they are valid. Put yourself in that position. I know we're superheroes. We never get sick. Nothing ever happens, but that's BS. Be empathetic. Be empathetic. So allow your client to acknowledge that. Help them deal with the overwhelm and the emotions. Let me say that again, plastic surgeons. Yes, you're busy. Yes, it's challenging. Yes, you don't want this to happen. Yes, you think they're going to blame you. Again, as I mentioned in the onset of this, a lot of things are out of everyone's control. Let's meet it head on. Let's acknowledge everyone's emotions and let's move forward towards solution. The best way for you as a plastic surgeon is to meet this head on and tackle it and solve it. Don't farm them out to wound care. Let me say this again. Do not farm your patient out to wound care. Take care of the patient. You are the plastic surgeon. That, in my opinion, makes you different than the cosmetic surgeon because as plastic surgeons, we're the doctor's doctor, we're the surgeon's surgeon. When there's a warm, hot red leg that was admitted to through the ER to the internal medicine service or the family practice service, or there's a spider bite, who did it call? They call you. When the orthopedic surgeon has done the knee revision and the incision falls apart, and now the prosthesis of the knee is open and threatened, and there needs to be skin, muscle, or something placed over that to salvage and save that. Who do they call? They call you or us. We're the doctor's doctor, surgeon, surgeon. So meet it head on. As the client, as the client, make sure that you have an incredible support system. Really make sure that you have close family, close friends, and it's okay if you need a little professional help in this time to get you through, to get you over the hump. Tap into the resources of people around you who may know mental health professionals. Ask your plastic surgeon if you feel, excuse me, that you need help with that process, and don't be ashamed about that. The second way to build emotional resilience is to be realistic about expectations on the front end. Have really deep conversations during the consultation with your surgeon about potential risk, of course, but worst case scenarios, what they look like, what they feel like, so that you can understand, digest that, and have a plan. That's why we're talking about this today. Have a plan that will reduce your anxiety, that will reduce, your feelings of overwhelm if this happens, because you've talked about it. This was discussed, you plan for it, and you're not blindsided by that. The last thing I want to point out about emotional resilience and building this is not a time for blame. You did this, you did that, you did this. Complications are part of surgery. I mentioned this before. This is, and I don't mean to demean the beauticians in the world. This is not a bad haircut. This is not a bad hairstyle. This is surgery. Again, we fail as plastic surgeons to give validity and validity to the surgery by saying that this is a major surgery. Again, we're on Instagram dancing around, and that's, if that's your thing, you do your thing. We show the before and we show the after. Everybody's happy, but we don't show the middle. You got to show the middle and realize that complications can occur, and it doesn't mean that it's anybody's fault. It's part of the possibilities of having a surgical procedure. The most important thing is not to blame, but to communicate and keep lines of communication open. Reach out to your plastic surgeon. Your plastic surgeon should be responsive. If he or she is not responsive, keep reaching out and reach out to other resources to help you with this problem. As plastic surgeons, be proactive, reach out to your clients, help them get to the other side. This is why they pay you as the plastic surgeon $16,000 instead of going to a poorly trained, non-trained plastic surgeon that will charge them $6,000. This is where the money matters. So that helps build emotional resiliency. I took a deep dive there. We want to make sure that we have a good support system. We want to make sure we have realistic expectations. We want to tap into mental health professionals if we need to. We want to make sure that we communicate well, and we want to make sure that we're not playing the blame game. That will help everyone's emotional resilience. Last but not least, we want to empower our patients and clients. Really, at the heart of our conversation today is we want to talk about empowerment. We want to take proactive steps that I've talked about over the last 30 minutes. We want to have financial planning. We want to have cosmetic surgery insurance. We want to allow for extra recovery time. We want to build a strong support network so you can handle whatever comes your way as the patient. It's really not about expecting the worst case scenario. It's just about being prepared for it. Let me say that again. It's about being prepared for it. And you want to take every precaution to protect yourself, both physically and emotionally, so that you can approach your surgical transformation, which is going to be amazing, with confidence. Your surgeon should always be part of the process. As the client, as the patient, don't be afraid to express your concerns to your surgeon. Don't be afraid to ask questions of your surgeon and his or her staff. Always seek advice throughout the journey. If you do these things, you will have a smoother recovery, but most importantly, you'll be well informed on the front ends to allow for that smoother recovery. So I hope you guys took the time to listen to the 5 points. There are realities of complications. You need to be prepared financially. Number two, you need to manage your recovery and work. You need to make sure that we have systems in place for emotional resilience, and we need to empower yourselves, or you need to empower yourselves by having these things and having these conversations before you proceed on to your fantastic transformation. And just as a caveat on the back end, two things. Because you have an unforeseen event doesn't mean it's the end of the world and you're going to have a disastrous outcome. With a skilled, board certified plastic surgeon, these things are 9 times out of 10 correctable. The process is daunting, as we said, but trust the process. I hate that phrase, but it really rings true here. Trust the process. This can be corrected. So take some assurance in that statement. So I want to thank you guys for taking 30 minutes today. Another short episode, but a really powerful episode to tune in to Plastic Surgery TNA. That's talking advice. I hope today was really valuable and gave you great insights to prepare yourself for plastic surgery and specifically for unexpected issues regarding your plastic surgery procedures. Remember, preparation is the key to navigating any challenge that may arise, plastic surgery or otherwise. So, being prepared is paramount. If you would like to talk about any other topics in future episodes, leave a comment. If you like this episode, leave a comment. Share this channel. It's really important. It helps me grow. It really does. And I can do bigger and better things. And I would like to do bigger and better things. My job is to provide, as I've said in many of my podcasts, truth and transformation, just not transformation. So I look forward to helping you feel your best. If you're interested in working with me, I champion that. You can certainly reach out to me in numerous ways. You can simply pick up the phone and dial my office. My number is 770-466-4700. I'm located in a bedroom community of Atlanta called Dunwoody, Georgia. So certainly would love to sit down with you and we take our time in our consultations. It's not rushed. We go over all these things and many more things to prepare you for your transformation. So again, I appreciate it. Also, before I take off for my Saturday, I am preparing an ultimate guide for you. If you're interested in this guide, I want you to say yes. Just type in yes in the comments. And if you would be so kind to provide me your email address, I will send you the guide. And so that you can be prepared for this. And the guide is called Surgery Ready, the ultimate guide for handling the unexpected. So, again, if you want the guide and you've watched this episode, you get the luxury of just providing me your email address and I will send the guide to you directly. You don't have to go to any type of social media post, click this link, click that link. If you're watching this and provide your email, I will send you the guide. So, again, I hope this helps. Uh, we're done for today. I hope that you return next Saturday for plastic surgery TNA. Wherever are in the world, I hope you're safe and have a wonderful Saturday. Until next time, this is Dr. Earl Stephenson Jr., your Atlanta board certified plastic surgeon. Take care.